Diabetes is a chronic disease in which there are high levels of sugar in the blood, which could result in death. And there are many components to diabetes, and the Skies Healthcare and Rehabilitation Center, located in Albuquerque, is meeting the needs of their patients, both physically and emotionally. And Kristina Maestas is joining us this morning to explain what type of care Skies Healthcare and Rehabilitation Center is actually offering to diabetics. Good morning to you.
Good morning.
Thanks for being with us.
Thank you for having me.
Well, let's talk a little bit first about the center and the services that you offer.
Okay, well, we are a skilled nursing facility.
Okay.
We have 116 beds. We offer 24-hour skilled nursing care, and then we also do physical, occupational, and speech therapy for people that require rehabilitation.
Well, for those who don't really understand, tell us a little bit about what diabetes is, if you had to explain it to somebody.
Basically what diabetes is it's a metabolism disorder, where your body produces not enough insulin or no insulin at all. Right. Insulin is really important because it helps move the glucose into your cells, which provides you with energy and also helps reduce your blood sugar.
So are we born with diabetes, or does it just happen?
Well, it depends on what type of diabetes you have. There's type 1, type 2, and then gestational.
Can you explain the differences a little bit?
Yes, type 1 is called juvenile diabetes, which typically you are born with. Type 2 is adult onset, and then gestational is diabetes that you can get when you're pregnant.
So is diabetes preventable?
Type 1, because you're born with it, generally isn't considered preventable. But type 2 and gestational can be preventable as well as reversible if you do get it.
Okay. Well, I know that there are a lot of complications that we worry about when it comes to diabetes. Can you tell us some of those?
Well, diabetes, if it's not managed right, can come with many complications. It will increase your risk for heart attack. You can get glaucoma, which is an eye condition. You can also have gum disease, foot ulcers, kidney disease, nerve damage. There's so many complications that come with diabetes.
But there's also a way to manage it, and that's what we want to give hope for people. So let's talk about the lab tests and examinations that we could get, or there's something specific? Do we need to get on a regular basis so that we can lower our risk of getting those complications?
Yes, no, that's a great question. There's 3 critical tests that you need to get done on a regular basis to help manage your diabetes.
All right.
The first one would be the hemoglobin A1C, that's what it's called. There's also a dilated eye exam, as well as a foot exam.
A foot exam?
Yes,
really?
a foot exam. Well, because some of the risks that come with diabetes include foot ulcers. And foot ulcers, of course, you want to check your feet daily to make sure that nothing is going on your feet that could be a concern.
I would have never thought. I'm so glad you said that. I don't think a lot of people would even realize that. So when we think about our day-to-day, what are some of the day-to-day activities that we can do to stay healthy and maybe possibly prevent getting diabetes?
Well, I mean, there's a couple of things you have to do to maintain any healthy lifestyle. And that's usually eating right and exercising.
Right.
So with diabetes, you want to make sure that you're eating lots of protein, like skinless, lean chicken and fresh vegetables. You also want to make sure that you're exercising at least 30 minutes a day.
Every day of the week?
Every day. Every day, 30 minutes. And that can be anything from walking, dancing, jogging, you name it.
Just physical activity?
Yes, just physical activity.
Okay.
And then also, of course, you want to have plenty of fluids, get lots of rest, and then, again, do the daily foot care.
I've heard over the years, and I've asked a couple different professionals about this, that people who get thirsty a lot of times I've heard that's a sign of potentially getting diabetes. Is that true, or is that just a myth?
That I'm really not sure. You can go to www.diabetes.org. And they have plenty of information, lots of answers to those types of questions.
When you mention eating right, would you say that if you think you could be prone to diabetes, or if it's a genetic thing in your family, that perhaps maybe you should avoid more sugar?
Absolutely. Absolutely.
Because I have heard over the years that it is a genetic thing. A lot of people do get it if it is in their family.
Yes, that can be true.
So that's one of the things to concern ourselves with. Now, where can we get more information? Let's tell our viewers one more time. So
well, again, you can go to www.diabetes.org. And that is a wealth of information.
Well, there's really no price you can put on your health, right? I talk about wealth.
Absolutely.
Your wealth is your health. So we appreciate you being here and kind of educating us on a subject that's so important and is affecting so many New Mexicans. And our state really appreciates all the help that you're doing. Thank you so much, Kristina.
Thank you.
And we'll be right back.